In today's Money Watch, we are talking about the importance of planning for health care in retirement. Could anything be more important? Listen to this. A new report estimates that a 65-year-old retiring this year can expect to spend $185,000 on health care and medical expenses throughout their retirement. That is a lot of money, and that includes the cost of Medicare and more. CBS News business analyst Jill Schlesinger is here to educate us all. Jill, hello.
Hello.
Okay, so just starting from the basics, please, for me and for everybody else who might need a little help here. Just break down Medicare, how it works, what it is.
So we have Medicare in place for now 61 years, and it came into fruition when there was a recognition that people needed help covering their health care costs in retirement. So Medicare is really focused on people who are over the age of 65. Doesn't matter how much income you have or don't have, you can qualify for Medicare. There's 70 million people who are on it, and it is funded partially by the federal government and our taxpayer dollars. And just a quick note that we often get confused between Medicare and Medicaid. Medicaid is for people who have lower income, right. Medicare for those over 65.
And so is it something people automatically get when they're 65?
No. And this is a huge wake-up call for folks, because if you've already claimed Social Security benefits and you've done so well before age 65, you may be automatically enrolled. But that's not the case as much anymore, because we know the full retirement age for Social Security is now 67. So what happens is 3 months before you turn 65, you have to go and enroll in Medicare. Now, you might be able to get off by saying, oh, I'm still working, or I get it through my employer, but you should register anyway. I want to be clear that Medicare, as it exists, is confusing. And I have really looked into this for a very long time. Can we break it down just by like all the different parts?
Please.
You cool with that?
I am.
So there are 4 parts of Medicare. Why 4? Because we kept adding things on.
Okay.
So there is the Part A of Medicare, which is hospitalization. And when you look at this, you say, hospitalization, isn't that automatic? Well, yeah, except then you have the medical part, which is Part B. You go to doctors. Then there was added this Medicare Advantage plans. Those are like the supplemental plans, because Medicare doesn't actually cover everything. And the final piece is prescription drug costs. Now, for most people, I would say the vast majority of people, the cost of this is, let's call it about $208 a month. However,
you have what you're paying to get Medicare?
Correct.
Which I'm assuming is not free?
It is not free. So you're paying $208 a month. It's usually deducted from your Social Security check once you do get it. But people think Medicare is free. It's not free. There's a cost to it. There's an extra layer of costs that I just want to point out. If you are lucky enough and you've got a bunch of money saved and you're pulling money out of your retirement account, and that's creating taxable income for you, you can have an extra fee on top of that couple $100 based on the amount of income. It's called IRMA. It's an income-related monthly adjustment amount. Did I just blow your mind?
My head is spinning.
Okay. 4 parts, couple $100.
Okay.
If you make a lot of money, you might pay more than that.
Got it. Thank you for that.
How's that?
Okay, but what about the $185,000 that people are going to spend on medical costs throughout their retirement? Like, where is that money
So
going?
I've talked to folks at Fidelity for many years when they've been doing this survey, and I think the reason they did this survey is that they were concerned that people thought Medicare is going to cover me. I'm
Medicare's
set.
got me.
Exactly.
Right.
And what they're finding is when you break it down, there is a cost for Medicare, which is, you know, obviously 45%, that's your parts B and D. Most people get A for free. But then there are the co-pays and the deductibles and the co-insurance that's not covered by Medicare out of your pocket.
Oh, the deductibles.
And then prescription drug costs, a lot of things that aren't covered, and vision is not covered. Hearing tests are not covered by Medicare. So I want to be clear that when people retire, I think they are shocked that they are going to be paying so much money for their health care. In many ways, the folks at Fidelity have said to me, it's like we have to condition anyone who's working right now and planning for the future to add, like, let's call it $600 or $700 a month for what you think you're going to need in your health care costs going forward.
We are almost out of time, but you say there's one thing people should know to plan for this.
Well, guess what? your Medicare is based on you as an individual. You don't apply as a couple. So it's as you come in 65, you apply singly. And also, Medicare does not cover long-term care costs. That is on you. So people who go into a nursing home, you've got to know that Medicare does not cover long-term care.
All right, Jill Schlesinger, preparing me for the future and all of us. Thank you so much.
Sure.
For more advice, check out her new podcast, Money Moves with Jill Schlesinger. New episodes drop every Tuesday and Thursday, wherever you get your podcasts. And you can watch, of course, on YouTube.